Assalamu alaikum. So for today, we will start our first session with the objective for first aid. So yesterday we talked about the general objective for the course and the number of hours. For today, we will start the first session. For the first session, the objective for this session is to define the emergency medical support and also to identify the 4 basic steps and describe the role, your role as a first aider or the first responder to the for each step. List the way on how disease spread. This is the infection control and how to prevent getting infection or spreading infection to the others while you are taking care of them. Enumerate the method to prevent the disease transmission. So this is the objective of this session. So about the emergency medical support. What do you know about the emergency medical support or the first aid? Who are they? What consists of? If we are taking here in Oman, what is the emergency medical support that is available outside the
special number calling?
Special number, it will call whom? The police or the civil defense, who are they respond to the emergency. But here, in general, it is not only this, because it is a networking of the community resources. So the resources within the community, they are together, they are cooperate together in order to fulfill the need for the first aid. So it include, yes, it include the police, because even in all of accidents that happen, police might come and either to give help or to see what's the problem and what's the cause of it, what we can do in order to prevent those kind of problem in the future. Also, the firemen and medical personnel, and also all of us, we are included. How we are included? As a citizen, what is your role as a citizen? Help. What kind of help at least? If you don't know anything, just to know whom to call. So at least you have to know what is the available thing and whom you can call for help. So at least in order to respond to that, by that you will be helping others in order to prevent loss of life, in order to save the life of others. So the system here, it begins when someone recognizes that there is an emergency. So if anyone passed by an emergency case and he recognized that it is a case of emergency, an emergency exists, and decide to take an action. That action can be just calling 9999 here, which is the local number for the emergency medical support. If he is able to do the care, then he will do some kind of care according to the need of the client. Even when he is calling, sometimes they will give him some direction and they will ask him some question in order to help that person. So your role in the medical support system include 4 basic steps. those 4 basic steps, the first thing is to recognize that there is emergency, that emergency is existing, that this is a case that need help, and differentiate between the cases which need help and other cases which normal. Then decide to act. Start doing things, action. Then to activate the emergency medical support system. The last thing, which is to give care until someone is taking over, until help came. So this is the main 4 role for you. Recognize that there is a case, decide to act, activate medical support system, give the care until the help came. Now, if we are taking those 4 also, how we can differentiate between a normal case or an existing case of emergency? If you pass going outside and you find someone is lying under the tree, is it necessary to be an emergency case? He might be sleeping, he might be taking rest under the tree. But if you find someone lying, but under the sun, there is no shade, nothing is there, in this case, it might be an emergency. Especially in a hot weather. No one will lie under the sunlight, especially in the hot weather, especially if it is in the midday. So by that you can recognize between, is it a case or not? If you hear some unusual sound of explosion, sound of something which is coming down, so it might be an emergency. Clashes of, it might be the sound of a car accident. So this will give you a sign of that there is might be an emergency, and there might be a victim there that you can help. So anyway, also some of the people, they might hesitate to take care in case of emergency. Why they are hesitating to take care in case of emergency, to give care for the person? Do you know why? Sometimes, if you are there and there is a victim, injured person is there, he might have bleeding or something like this. What's the thing that it came to your mind that might prevent you from taking care for that person? What do you think? You are thinking to save life. In this case, you will act. What's the thing that prevents you from action? Yani, you are trying to help, but some idea came to you, and it told you don't take care, why? What is, because so you might be scared. Why you are scared? You didn't have a confidence in giving care. You think that you might aggravate the problem of the patient, of the victim. So this is one of the thing that might prevent people from taking action. What other thing?
We thought that this patient had a contagious disease.
So this is another thing. Thank you. So this is another thing. You are fearing from getting infection from that person. You think that he might have some infectious disease, contagious disease that might be transmitted to you. Because of that, you are feel hesitated to give care for that client. What other thing? Why you feel that you will not be able to give a care?
He didn't have the knowledge.
So you don't have the knowledge for giving help. You don't know what to do.
Maybe the cases is when you age, the birth maybe becomes more bad.
So you feel that the condition of the client, it might be aggravated, it become more bad if we are trying to give care because of lack of experience mostly. So this is the thing. So about this is one of the things that infection, we might fear from getting infection. How we can reduce the possibility of infection? So we have to encourage people at risk to change their behavior in this way. The most important thing in dealing with others in order to prevent infection is to wash your hands. Wash your hands before and after you do the care. So if you are doing the care after that, just most of the infection, most of the bacteria, it can be washed out, can be cleaned by washing your hand. If you are exposing to a client with any kind of infection, use a clean hand. Use gloves. You can use gloves. I know that most of us, or maybe 99.9% of us, we didn't have always gloves with us, especially when we are outside. So, does that prevent us from taking care? No. Because you have to think of saving life first. We can use other things in order to prevent infection. The problem we have to prevent a direct contact between our body and the other client secretion. Any body fluid from others, like blood, like saliva, like urine, like those are the most thing that might carry bacteria or virus or whatever the cause of disease might be there. So even we can use a plastic bag for the care. If not, nothing is there, you can act, but wash your hand with soap and water, with sanitizer. Sanitizer was there with everybody during the last period. So use that. Also, there is another thing that after or during the care, don't take food during that after the care and before washing your hand. So some of the people immediately after they gave the care, they are going to take food. No, we have to wash our hand previously in order before taking food. We have also to provide a product that offer automatic protection for this is for the injury. For the injury, in order to prevent the injury also, We have to prevent infection. We have to prevent the injury. We have to provide some product in order to protect ourselves from getting injured. What kind of thing that we can use to protect ourselves from getting injured? In the car, what you have to use? What's the safety measures that used in order to minimize the injury? Seat belt, using the seat belt, using also the car with airbag. Those, it will reduce the possibility of injury. If you are riding a bicycle, in this case, the yes. So if you are using the helmet and covering your head properly, the proper one, it will decrease the possibility of head injury. So if you are working, if person are working in construction, in building, they have to use a boot which have a hard one, which prevent a nail from coming inside and injury by the nails. So those are many things. There are many things according to the work that we are doing. So in order to reduce the personal risk, you have to know what are the risks which is around you according to your work that we are doing. As a nurses, what are the common injury that we might be exposed to? Yes, so as a nurse and in the medical field, mostly we are prone to infection because we are working sometimes with a person who are having some infectious disease. In this case, we have to take precaution in order to prevent infection. Take measures that make a difference. We have to take our precaution. Be alert to the harmful condition and the activities that's harmful for us. Learn to use the first aid skills. So we have to learn how to use a first aid skills. What should you do in case of emergency? The first thing that you have to do in case of emergency, you have to recognize that there is a case. As we said before, then decide to act. Call the emergency number for help, which is the quadri 9. Provide care until they arrive. Before they arrive, also you have to do some steps. The step 1, you have to recognize an emergency, as we said. How do we recognize it? If there is unusual noise. If we hear unusual noise, noise of explosion, noise of something is coming, hitting the ground, in this case, we might expect that some injury might happen. So, in this case, we can see what's going on. Is there any injury or not after that? Unusual sight. If you are seeing something unusual, as we said, if we are seeing somebody is lying under the tree, it might be that he is sleeping there, he is taking rest. But if he is in a corridor, if he is at the street, in this case, it is not that one. He might fall down, he might lose his consciousness, he might have an injury. Unusual odor, smell of smoke. It indicates that fire is there. Smell of some chemical substances. It might be a toxic material that might lead to also suffocation or so unusual appearance or behavior. All of us, and in the class here, everyone is sitting beside his friend and he know how he is behaving, isn't it? This is not the usual. He know the usual behavior of that friend. But if behavior is become different, he has to expect that something happened to him. Why the behavior might be different? What's the change? In which cases it might happen? What kind of it? He is sitting beside you. So, in the class or in the office or so
He just became unconscious.
yeah, he might the behavior changes. It might be due to loss of what? Yeah, loss of oxygen to the brain, loss of sugar,
Yes.
loss of nutrient. That sugar is going down, blood pressure is going down, or he is having heart attack, or so there are many consequences that might lead to loss of the normal nutrition to the brain, which lead to change of behavior, or in this case you have to be worried about him and to see what you can help and to act as immediately as possible. By that you might save him. The second thing, so you recognize that there is a case. Only now recognition. أدركت إنه في حالة عندك. So the second step, there might be a barriers that prevent you from taking care. So we have to come over the barrier. The barriers, we mentioned some of those barriers before. So, like the presence, sometimes the barrier, it might be the presence of other people. You know that in case of accident, especially if it is within the city or inside or if someone fall down inside a supermarket, or what will happen? What do you expect always? What will happen around him?
People will get emotions.
All of those who are in the market, they will come around him. This is from the baddest thing, just to see what is happening. So, yes, we have to respond. But if too many people are there around that person, sometimes the one who want to act, he will hesitate to act. So the one who is bitter, he know himself that he can do better care for the client. He has to act in this case. What's his action? His action is to call someone to keep the people away from him and to act with the client in order to assist him and start to do the care for him. So sometimes we feel shy, or we feel that all of who are around us are observing us what we are doing. So it might prevent us from taking action. The second thing, uncertainty that the emergency really exists. I don't know, is it an emergency care case or not? So I cannot decide. I am hesitant. I couldn't identify that this is a case of emergency that I have to act or not. So due to lack of knowledge, lack of experience sometimes. So I might pass by the person and I don't know that is it a case that I have to do care or not. The type of injury sometimes. Sometimes if the type of injury is a serious injury, some of the people, they have a fear, sometimes even some of the people, they may fall down just when they saw blood is coming out. So you have to have a strong heart in order to act. Even sometimes some of our students in the clinical area, in the operation theater, sometimes they are falling down, and in this case, the team has to work with both, with the patient who is there and with the one who as a trainee. So you have to strengthen your heart and to try to do that. So the type of injury, sometimes it might be a serious injury that fear to catching disease. And we said that what we can do in order to prevent catching of disease. Fear of doing something wrong. For fearing of catching disease, yani, even if most of the infection can be treated, isn't it? Also, you will study later on microbiology that in order to get the disease, it is not only to get the microorganism only. So it is the microorganism, the type of microorganism, because there are some infectious and some microorganism which is normally existing, or which is called normal flora. It is there in our body. It prevents the other bacteria from causing disease. So there is a virulence of that, the bacteria itself, the virulence of each bacteria or virus. So it is different. Our immunity also. So when our immunity is good, also if some little bacteria came, or our immune system will act and to prevent the us from getting infection. So there are many things. And the preventive measures that you have to take a precaution in order to prevent the disease by cleanliness and mostly hand washing, and prevent direct contact with the patient excretion and blood. So using gloves in this case, using mouth shield when you are giving mouth-to-mouth breathing. The fifth thing, which is fearing of doing something wrong. You are not sure that of your ability to act. The sixth thing, fearing of being sued or called by the court sometimes that you are doing something wrong. And sometimes it happens because some of the people there, they might say that you are the one who aggravate the problem. If they don't know what you are doing. Also, cultural and religious reason. So sometimes the culture, especially if you are male and the victim is a female, or you are a female and the victim is male. So the cultural difference, even in our religion, help is we have to act regardless to our sex. And you remember with our Prophet Muhammad, Nusayba al-Islamiyya was there with him, and she was saving the injured people. She was helping the injured people. She was a lady. we didn't heard about any, during that we didn't hear about any man who was going there. So the step 3, activate the emergency medical support system by calling the quadri 9. When you are calling, you have to give your phone number. So the first, you have to introduce yourself, give your phone number, give the address, give the number of victim, how many victims are there, what type of injury which is there, and you have to stay on the line until they because they may give you some hints for first aid until they arrive. So don't just call them, oh, there is an accident here, and close the line. No, you have to give a full information. The address, your phone number, then the number of victim, what kind of injury is there, because sometimes they might need the ambulance, they might need an ambulance and the fire extinguishing, and they might need also the police to come. So this information will give them who are needed to came to that area of accident and what kind of help is needed, and if they can also guide you in order to do some action until they come. And it is also for free. So those number, nothing will be cut from your account, from your phone. So it is free. Step 4, we have give the care until the emergency medical supports arrive. So we have to continue to provide the care until more high trained people arrive to there. Always we have also to remember, moving victim only if his or her life is in danger. So usually the first aid, it is the care which is provided at the site for the victim at the site of injury. So first aid, usually it is the care which is given at the site of injury. When we can move the client, we can move him if there is in danger on his life and in our life. So whatever, before doing anything, we have to see the scene, check the scene for safety. We will not act while the scene is not safe. Yani, if an accident happened in the main street, shall we run immediately to the main street without saving the site? The first thing, we have to save the site. We have to stop the other vehicles from coming, because other vehicles can take us with it. In this case, we are putting ourselves in danger. So we have to save the scene, and we can take the person to the side, then we can act. Ask a conscious victim for permission before giving a care. We cannot give a care without getting a permission. طيب. If the victim is unconscious, shall we give a care, or we will wait for someone in order to take a permission? We have to give. So unconsciousness is a permission for the first aider to do the care without taking a permission. If someone is around, we have to introduce ourselves that we are I'm a trained first aider, so can I help? I will be able to help her. So check the victim for life-threatening condition before providing further care. So I have to check the threatening condition to life first, then to act on other injury. Yani the patient might have bleeding, the patient might have fracture, the patient might be in a position that his breathing is not properly maintained. So the thing that I have to look first here is to see that is he breathing well or not. So maintain the airway. Then I will go for the bleeding, because if I want to stop the bleeding while his neck is not in a correct position and he is unable to breathe, yes, I will stop bleeding, but he will die. Why? Because he is unable to breathe. His heart will stop and he will die. So the first thing is to go with the more threatening condition. If he is conscious, if he is breathing is that, so I will act with the breathing. Then I will go to the fracture or other injury. Give appropriate care and to an injured person until you see an obvious sign of life, such as breathing, pulse, and movement. This is for unconscious client, or in case of CPR. So we have to give the care until we see that sign of life are there. If another trained responser came and take over, so in this case he will take over and you will go around. If you are too exhausted and unable to do more care, you feel that you cannot do anything more. So if you are alone and you couldn't get anyone to help you, in this case you will not stop until you feel that you cannot do anything more. خلاص. Or if the scene is become unsafe. If the scene is become unsafe, if the area is become unsafe and there is a danger on me and the client, if I am able to move him, that's good, or I have to escape. Yeah, yani if the patient is in the car and you feel that fire is coming and explosion might come, in this case, why to put myself on danger and I might be the second victim? Or something, I saw that something is going to fall down. In this case also, why to put myself in danger? So in this case, I have to save myself. About disease transmission, we said something about disease transmission in the beginning of the session. Here, there are four for a disease to be transmitted to the following factor. It has to be present. The infectious agent, it has to be. So there has to be a pathogenic organism, because as we said, we have pathogenic and non-pathogenic organism. جراثيم معدية أو ممرضة وغير ممرضة. Route of infection. There has to be a route of infection, of entry for the bacteria or for the virus. So some of the bacteria it can enter through the respiratory system. Some it can enter through an injury. So if we have an injury, it has to be covered before taking care of others. Dose of pathogen, the amount of bacteria or virus that we are taking. and depend upon the period of exposure and depend upon the contamination that we are dealing with. Also, the fourth thing, which is the susceptibility. Our susceptibility. Are we susceptible to infection? Is my immunity is low? Do I have something that make my immunity low? Do I have another disease that make my immunity low? Like in case of pregnancy, the immunity it will be slightly low. In case of other diseases, like if you are diabetic, if you are doing renal dialysis, if you are debilitated, or in this case your immunity will be low and susceptibility to infections will be. But mostly, every day we are getting some kind of bacteria or viruses, but our body is dealing, our immune system is dealing with it and prevent us from getting infection. And we are taking precaution also. We are we are preparing our food in a proper way. We are washing the vegetables. We are washing our hand before eating. We are trying to get a good food. So this will decrease the infection. Disease can spread by droplet infection. It can be by direct contact, especially skin diseases, and it can be through direct contact. It can be through bites also. Insect bites or bites of animal or bites of so there are many things. Indirect contact sometimes, which is contact with the patient properties like clothes or towels. The prevention of ourselves from getting infection, we have to use or to follow some of those aspects. One, we have to avoid contact with body fluid. Always avoid to contact with the body fluid, saliva, nasal secretion, blood, urine, feces, all of those, because it is mostly contaminated. Use protective breathing barriers while you are doing using mask or protective barriers while you are doing CPR. Wear gloves, disposable gloves. Cover any cut or wound or sore that on the skin, any contusion in the skin, you have to cover it. How to protect also from being infected? Don't eat or drink or touch your mouth or nose when you give care. So during giving care, don't touch your mouth or face or nose, or take food after that before washing your hand properly. Be prepared by having the first aid kit if it is available. Wash your hand with soap and water after the care. So immediately after the care, wash your hand properly with soap and water. By that, you will minimize the possibility of infection. In the assessment, you have the first thing that you have to assess, you have to the safety of the area before acting, before doing anything. You have to assess the safety of the area. As we said, if somebody is in contact with electricity, don't go beside him unless you put the main electricity off. Otherwise, you will be catched by the electricity again, and you will be the second victim. So, if it is in the street, you have to save the site before acting. The mechanism, you have to assess the mechanism of injury, how it has happened, and what is the consequence of it, what might be there, number of victim also, and the resources needed. What do you need for in order to help the person? In the assessment also, we're performing the initial assessment, the first assessment, we have to see first the level of consciousness. Yani, if someone is, if after an accident, if someone is lying, or the first thing that you have to try to call him. If you know his name, you call him by his name. If you don't know his name, just call him by the name which is commonly used for that person. Brother, أخوي, الوالد, الوالدة. If he responds, so definitely no one will respond while he is unconscious, isn't it? So if he responds to you, it means that he is conscious. Now I will go to the second step. If he didn't respond, now I have to check the ABC. Does he breathe? Is there a pulse? So it will go the airway first. Is the airway patent? So I have to clear if something is restricting on his neck. I have to clear it. I have to put the head backward in order to keep the airway clear. Then check the breathing. Did he breathe or not? I have to see the chest movement. I have to hear the if breathing sound. I have also to feel if the air is coming from his mouth, or by that I am checking the breathing. If nothing is there, I will check the circulation by carotid artery. If you don't know to check the circulation, if he didn't breathe, you have to consider that there is no circulation and act upon that. Then the step 3, perform physical examination. We are doing what we call it the dots. This is for conscious patient. You are checking for deformities in order to see the injury, where is the injury? If deformities, that might be fracture. If there is open wound, so the O, it is stand for open wound. The T, it is standing for tenderness. While checking his body, I will see what's the area that he is feeling pain when I touch them. Then the S, it is stand for swelling. الورم نتيجة لأي ضربة أو there might be swelling. So there might be deformity, open wound, tenderness, and swelling. So this is the, what we call it, the dots. There is also other assessment which is called sample. Sample, this is abbreviation just to help you in what kind of assessment that you want to do. So the S, it is stand for sign and symptom. العلامات والأعراض. So this is for conscious patient. You will ask him, what is your complaint? What is the sign that you are feeling? What is the symptom that you are complaining from? What the sign that I can see it? The sign, it is the thing that I can see it. Allergy. I will have to ask him if he has an allergy, because in any case of emergency, you might expect that he might go in unconsciousness. So I have to identify and ask him for allergy. to ask for allergy in order to avoid giving him something that might cause allergy for them later. Medicine, if he is taking some medication regularly or not, or if he took some medicine before. So because it might be the action of that medicine. Patient past history. تاريخ المرض السابق. I have to ask him about the. Then last oral intake. أنت آخر وجبة أخذها أو آخر إشي أخذه because he might be in need for operation. So in this case we have to see the last thing of intake. Event leading to incident. What's the thing that happened with him? طبعا sometimes I may show that or in a car accident or what we can. So just to it will help in the care after. So just I will stop here and the second session I will continue. Thank you.